afternoon, Dr. Chapman.
Hi, Angela. Good to see you.
So, as we have discussed recently, since the pandemic was declared, we've had many questions from Alpha-1 patients inquiring about how they can best manage their Alpha-1. So today we've put together the most frequently asked questions from Canadian Alpha-1 patients to address their COVID-19 concerns. So we're going to try and stay on track and make sure it's pretty specific to COVID-19. Canadian Alpha-1 patients would love to have your ear for a couple of hours and consult with you around all kinds of questions, but we're going to try and stick to COVID-19 today. And I must tell you, since March, the number one question that we have received is, are Alpha-1 patients more likely to contract COVID-19? And we get it all day, every day, hearing from patients from coast to coast.
I suppose the quickest answer is, I don't know. COVID-19 is new. There aren't a lot of observations and statistics, but that's not very helpful. So I say, don't think so. I don't think that Alpha-1 patients are more likely to get the disease. There's nothing about the initial defenses in Alpha-1 that should make you more prone to acquire the infection. The question then is, if patients with alpha are at the same risk level as everybody else, are they at greater risk of a bad outcome, getting those complications we hear about, ending up in the hospital, needing oxygen, or heaven forbid, but a breathing machine, a ventilator? And the answer is maybe. We've been looking at the large reports from various countries, including our own, that have had COVID cases. And there are a list of people who don't do well. Now, I think we all know from the popular media, the older you are, the greater the risk of having a bad outcome. One of the other things we don't hear said very often, but it's true, men don't fare as well as women. For some reason, women seem to do a bit better. And then having some chronic conditions can lead to a bad outcome. So here's where the alpha question comes up. Now, listed in those chronic conditions are a number of interesting things that don't necessarily apply to alpha-1 antitrypsin deficiency. People with diabetes are at increased risk. People with high blood pressure are at increased risk. People with heart disease are at increased risk. But somewhere in that list, there is COPD, and as you know, alpha-1 can produce COPD, emphysema in particular. So by virtue of having COPD, if that's what you've got with your alpha-1, the information we have says you're at increased risk of a bad outcome. Now, how important is that? How significant is that? Actually, what I can tell you is, as far as that list of bad things goes, COPD is well down on the list. It's not one of the common complicating factors. It's not one of the biggies. And it probably depends on how your COPD is. Is it a little bit? Were you perhaps diagnosed early because of some family screening? You've got a little obstruction? Well, I don't think your risk is very high. Do you have severe obstruction? Well, then your risk is probably higher. Now, having said all of those things, I will tell you, and I'm going to start telling this to all my patients, alpha-1s or not, the acquiring COVID-19, getting that infection, is not a death sentence. You would think that from reading or seeing the popular media. On Wednesday, so as we record this a couple of days ago, my first two digital contacts with patients in the day were patients with COPD. The first patient had managed a 2-week hospitalization with COVID-19. She is 83 and survived and is home and is recovering her strength. The second patient, not quite so old, had COPD and in fact was an alpha-1 patient, well past retirement age, and she has tolerated COVID-19. In fact, stayed at home the entire time and has returned completely to baseline. So I've given you one of those very long-winded answers. You're going to run out of time to show this, but yeah, COPD patients are on the list of people who may run into problems if they get COVID-19. The worse your alpha COPD is, I guess the greater your risk, but people survive it, and that includes alphas. So do all the right things, but if you catch it, it could still turn out all right.
So, saying that, are there additional measures in addition to all of the public health measures that we've been hearing about for months? Hand washing, physical distancing. Is there anything else that Alpha 1 patients should do in addition to those things?
Good question. That will send me off on another 30-minute tangent. Well, first of all, do all the things that you're doing that are good for your illness. So if you're on a good set of inhaled medicines, keep taking them. There is no evidence that inhaled medicines get in the way. If you've got an action plan in place for flare-ups, bouts of bronchitis, use it if you get one of those bouts of bronchitis. So the antibiotic, even the prednisone, if you and your doctor have decided that that's what you need for a flare-up. So do all those usual things. If you're on augmentation therapy, the intravenous therapy, keep taking it. The only thing said somewhere early on in all of this was if you're trying to isolate and going out, if that's what you're doing, for once a week infusions, you might consider moving it to once every 2-week infusions just to maintain the isolation a bit better. I think we were going to talk about that strategy a little bit later, so let's get back to that. It's not a strong recommendation by any means, but you can do those things. Now, anything extra you might do. I hesitate about the next part because I think one of the issues that comes up, whether it's alpha or tobacco-related COPD, my patients say, well, how do I know? Like, if I get a cough and have some phlegm, and well, how do I know what I've got? Is it COVID or just a run-of-the-mill bout of bronchitis? So I would say, again, do the usual things. But the only thing you may not have heard about before that I think might be wise is to check your oxygen level. And if you have a fingertip oximeter, you know what I mean. If you've been to a pulmonary function lab, you know what I mean. Somebody applies this little clip, it shines light through your finger, checks out the blood flow and the arterial blood in particular, and it comes up with a reading, which we hope is above 90%. Turns out those little fingertip oximeters are available online. I hesitate to say Amazon because that's one brand name, but you can shop online. And these devices you can purchase for, I think, as low as $35 Canadian and up to about $70 or $80. You might want to check and see what your oxygen level is now when you're healthy, morning, evening. Don't get obsessive about it, but it should be above 90. If you go for a walk for exercise, and that's a good idea, check and see what your oxygen level does. Alphas tend to have a little more oxygen difficulty than run-of-the-mill, I can say that, COPD patients. So see what it does when you go for your walk. Should stay above 87. But if you get that chest cold, back to that bout of bronchitis, and you say, boy, I have to worry about this, pull out that oximeter, see what your oxygen level is. And if that's kind of low, if it's dropped below 87, you might want to give your doc, whether that's your family doc or your lung doc, a call and say, hey, there's something out of the ordinary about this. One of the observations that's been made somewhat informally is that during COVID-19, people, alpha 1 or not, seem to run into oxygen difficulties, and they may do so without actually being aware. The oxygen level drops when they show up in the emergency room. It's really low, and everybody's surprised. One of those fingertip oximeters might not be a bad thing to have.
Okay. So that's it about contacting your physician. We get a lot of calls around whether patients should be keeping their physician appointments, their clinic appointments. Is it safe to go?
The answer is yes. It is safe to go. That is, if your physician has decided that it's appropriate to open the office to you, safeguards in place, and the community level of COVID-19. So, for example, right now, if you had a routine appointment to see me, I would not be booking that to come into the hospital. I'd love to know what your breathing tests show, but we're not going to do that. We're going to talk on the equivalent of Zoom or on the telephone. And if everything's stable, we're going to repeat your prescriptions and catch up later on. In another month or so, I'll start making some more urgent patient visits directly in the office and getting breathing tests. And maybe a couple of months after that, the office will resume, and the difference will be there will be fewer patients, less of people waiting and contacting one another in the waiting room. In other words, things are going to happen at a somewhat slower pace.
Right.
But what I've always said to people is, hey, look, in your doctor's office, in the lab, trained medical professionals are doing the things they've been trained to do. They're wearing masks, they're using shields, they're prioritizing patients, they're ensuring that there's distancing in the waiting room. So it's safe to go to your doctor's office as compared to, say, going to shop at Loblaws, or if you're in Toronto, you'll know what I mean, going for a Saturday afternoon stroll in Trinity Bellwoods Park. Social distancing is going to happen in your doctor's office. They will take precautions. Yes, please go.
Well, and along those lines, it won't surprise you that depending on the province, things are starting to slowly open up. There is a concern among Alpha-1 patients across this country about returning to the workplace because they have even though they're concerned about going to clinics and to see their physician, I think most patients recognize that they'll have protective equipment, but workplaces are still in question. So Alpha-1 patients with a pre-existing condition are concerned about returning to work and are looking for some guidance as they make those decisions.
Sure. And so I'd say it's a question that comes up all the time. And my answer is, if you have significant alpha lung disease, you are at increased risk. It is reasonable to ask your employer to accommodate that. Now, it may be you're fortunate to have a job where you could largely work from home. Or perhaps the accommodation could be that your job shifts so that instead of facing the public and meeting people who might be bringing virus to the office, you're working in the back room or the equivalent thereof. For some people, it's going to be a question of, can I get, in effect, disability from my employer to be away during the high-risk period of COVID, assuming it continues over the next several months. I can simply say, for my own patients where we've documented lung disease related to alpha, I am writing letters, and it's going to be dealt with on a case-by-case basis with employers. Some will be willing, some will have alternative workspaces and options for patients. Others are going to be more difficult. The other related question, and maybe you're going to ask me this, was, what about my partner, my family member who doesn't have alpha, but is going to go out into the community to his workplace? And that's a tough one too. It is perhaps fair for your doctor to document that you, the patient, have alpha, and that the other member of the household might bring it to you. My limited experience so far is that employers don't really care, but it's worth a try. I think what ends up happening is you try to take reasonable precautions with your household member who leaves the house and comes back. If you're lucky enough to have a household with 2 entrances, so-and-so changes at work, comes in the side door, goes downstairs, showers immediately, etc. You do what you can. Yes, I think it is a concern that the return to work is hazardous directly for alphas with lung disease. Some accommodation needs to be considered. Family members, tougher to get that done. But you should be able to ask your doctor for documentation that there's an issue at play. I'll say one last thing, and I apologize that these are all such long, long answers, but I keep thinking of things that I've said to people that may be important in particular situations. About 3 years ago, Canada, legislation was passed that was supposed to prevent genetic discrimination. So your insurance company, your employer, etc., is not supposed to be able to discriminate on the basis of your having a genetic disease. I don't think I have to tell anybody who's listening to this webcast that alpha-1 is a genetic problem. And so maybe an ACE card, if you're really pushing hard for your employer to accommodate or his insurance provider to accommodate, is to point out that you have a genetic problem and it's against the law to discriminate against you. So it'll be interesting to see if push comes to shove how that plays out. But worth checking on that.
GINA, the Genetic Discrimination Act, right?
Thank you. Yes, and I don't know, maybe you'll post a link to that on the.
We do. It's actually on the Alpha-1 Canada website. So if anyone needs some information, they can get it on the Alpha-1 Canada website. The next question was very specific. I'm not sure how COVID related it was, but it speaks to an ongoing confusion among a lot of Alpha-1 patients about taking antibiotics and if it cancels the effect of augmentation therapy. We heard from a patient saying she was taking a triple therapy for MAC and wondering if that would, in her words, cancel the effect of augmentation therapy. And we often hear from patients wondering if they can maintain their infusion schedule while taking antibiotics.
Well, first of all, that last little bit, if you've got a bout of bronchitis and want to take antibiotics and need to take antibiotics, yes, please get your infusion. It's during exacerbations, bouts of bronchitis. All those white cells go running off to the lung. They'll release their elastases, that bad chemical that can damage the lung. It's meant to just chew up bacteria, but it can damage the lungs. And that's when alpha patients are most vulnerable. So if you've been going to an infusion clinic and now you're taking antibiotic and they say, no, we don't want to give you your infusion, demand your infusion, that's especially when I would want you to get it.
Okay.
Somebody asked the special case of NTM or MAC. You may know, some folks on the webcast may know that alpha patients seem to be a little bit predisposed to get MAC infections or non-tuberculous mycobacterial NTM infections. The thing to know about them is they are slow growing. The germs are hard to find. If your doctor's found it, it means your doctor is really on the ball and doing his or her job, so that's great. No evidence that taking augmentation therapy cancels the effect of the antibiotics. I'm going to steal from my colleagues next door. I work next door to not one, but two of the smartest people in the field of NTM infection treatment. And we've had this discussion many times. And when it comes up and they're dealing with an alpha patient, they would actually like to add in augmentation therapy as an anti-inflammatory to reduce damage. So yes, please continue taking your augmentation despite your triple therapy for NTM. Great,
thank you. Another question I get almost daily is about the signage, which I think it's fair to say we have all seen in physician offices, pharmacies, even infusion clinics, telling patients that if they have a cough, not to enter. And we hear from alphas that have frequent coughing due to their alpha-1. And they're stopped by these signs and employees asking if you have a cough, not to enter the building. So it goes back to, you kind of mentioned it earlier on in our discussion, how to know whether a cough is related to alpha-1 or when it's time to go and get a test for COVID.
The question used to come up previously as well. There were always little signs that talked about symptoms, and if you had symptoms, please don't bring them to the office, to the hospital, whatever it may be. And I think the problem is the signs are in short form. They try to be quick and blunt. And what the sign should say is a new or changing cough. So if you have a bit of a cough and you raise a tablespoon of phlegm every morning and maybe a couple of times later in the day, and it's always been like that, no, that's not the problem. You can have that cough and still come to my office. But if your cough changes, it's now a lot more phlegm. The phlegm has changed color, you're more breathless. Well, okay, that's a new cough or a changed cough. I would say in the new COVID-19 era, you would be in touch with your family doctor's office or your doctor's office and say, okay, I'm coming in, but my cough has changed. What should we do? My guess is that most docs will try and stick handle that virtually through the telephone, through a telehealth encounter, and that may be very simple for a mild exacerbation. They may have some other directions, and if you're a little sicker, if there really is a possibility that because of headache, fever, aches and pains, loss of sense of smell, they may make an arrangement to see you, but at the very end of the day, with appropriate gloves and gowning and so on to minimize everybody's risk. And they may direct you even ahead of that to go to a COVID testing center. So right now that means one of the provincial testing centers, although I recently read one of the large commercial labs is making those nasal swabs for COVID-19 available. So bottom line, your old familiar cough is no reason not to go into a medical environment. If the cough changes, make sure the medical environment knows this in advance and has a chance to address it before you come in.
Okay, great. This takes us to the hot topic of face masks.
Yes.
We have had several patients inquire whether it would increase their chances of having exacerbations by constantly wearing a face covering.
No. One of the large asthma organizations put up a fact sheet and with no evidence whatsoever said that masks could make asthma worse. And I'm quite annoyed at that. There's no evidence whatsoever. And there's no evidence of that for patients with COPD. So quite honestly, nobody likes wearing a mask. They get hot and uncomfortable. And when I get into my office and close the door and I'm all by myself, I love to take mine off. But no evidence that wearing a mask can increase bronchitis or exacerbations.
Great. And a question I think you probably hear quite a bit as well about infusions and managing. During COVID, we've seen an increase in this question around getting infusions once a week versus twice a week, just to lessen the time you have to leave the house and go into clinic. Can you help patients understand if there is a difference and what should they be looking at?
My bottom line is that infusions every 2 weeks are not as good as infusions once a week.
Right.
The problem is that at the end of the 2-week period, the blood levels of alpha-1 are quite low, and in some people, 15 or 20%, they actually drop below what we think of as the protective threshold. So I'm not keen on infusions every 2 weeks. But in the early days of the pandemic, when I was being asked questions, I said, well, okay, if we're not sure about the infusion clinic and the community's safety, that might be a reasonable precaution. I almost regret saying it, and I did say at the time, but after the risk has diminished, I would like my patients to go back to once a week. So, yep, you can switch to every 2 weeks. Not quite so good if you're really going to make the investment in time. Do it properly, make it once a week. And again, back to the other question, so is it safe to go to the infusion clinic? Oh, trust me, the infusion clinic is taking all precautions. They are distancing, masks are in place, they are screening and so on. So I think it's a very safe place to go.
Well, and I think everyone has heard you speak about flu shots in the past. patients are wondering if it will add an extra protection from COVID, and if you would recommend a booster.
No, I don't think the influenza shot will offer any help against COVID. And if we're talking about a booster for this year's influenza vaccine, no, I wouldn't bother doing that. I do hope, I always look for silver linings in this, that all of those silly anti-vaxxers will stop saying silly things, and we'll all agree that a flu shot's a brilliant idea and everybody should get one, with very rare exceptions. Certainly all of my patients with alpha, all of my patients with COPD, all of my patients with asthma. But I'm going to add, I'd like everybody who listens to this who might be of a certain age to remind your niece and nephew, the 20-something, who says, oh, I don't need the flu shot. No, maybe your 20-something niece or nephew doesn't need the flu shot for himself or herself, but they need it for you. Because I think everybody now has heard about herd immunity. If they don't get the flu, you're less likely to get the flu. So I really do hope we carry some of these messages forward.
Likewise. So that takes us to our last question. It, again, probably won't surprise you that there are many suggestions in social media around home remedies to manage alpha-1 and COVID-19. So patients are asking if there are any home remedies that not only could help manage their alpha-1, but also build their immunity. We have received questions about HEPA filters, humidifiers, vitamins, and supplements. Is there any evidence, or is there anything you could suggest that alpha-1 patients may or may not try?
There are no home remedies that I know of. All of those boring things you've been hearing about, the distancing, the hand washing, the masks, and so on, are the things to do. HEPA filters are interesting, but they won't work for COVID. Certain types of ultraviolet light that are kind of hard to get might do something for COVID. You'll probably see that used in some medical environments. Humidifiers, no. And as for dietary things, I would just say diet should be such that you don't get too fat. Carrying extra weight is not a good thing. We talked about that earlier with COVID in particular. Don't want to get too skinny, and emphysema patients can start to lose weight at some point, and that's because those overinflated lungs tend to push on the stomach. So the trick is frequent small meals. We move away from the lifelong habit of 3 large meals that are bloating, hard to absorb. And vitamins, no. Talk about vitamin C, vitamin E, multivitamins. Certainly they're harmless. The only vitamin that comes up in the respiratory field that has a little bit of evidence behind it is vitamin D. Now, I quickly add, this has nothing to do with COVID-19, but you've heard, I'm sure, that living as we do in the Northern Hemisphere, living in days that are somewhat short, we're exposed to less sunshine, we may not make as much vitamin D as we should, and it's been recommended that in general, people could supplement their diets with vitamin D. And certainly one of the things you can purchase relatively cheaply at the drugstore is vitamin D. So back to things respiratory, it seems to reduce a tendency for asthma exacerbations, and I quickly add in children, the effect is very, very small. So that's as close as I can come to a vitamin recommendation for things respiratory. Nothing in particular to do with alpha. If you want to take a vitamin, though, that's probably the one you'd pick.
Great. Well, thank you. Questions will continue to come in, and I think as things are shifting, whether patients are in BC or in Nova Scotia, I think it's fair to say we've addressed a number of COVID-19 and alpha-1 concerns that patients have across the country. And we've made it 3+ months in quarantine. And depending on where COVID takes us, perhaps we can circle back in a couple of months. If new questions pop up, we'll encourage patients to reach out to Alpha-1 Canada and add to the list. And we'll regroup in a couple months. But thank you so much for your time.
Thanks, Ashley. You do a great job. I think it's so, so important for all patients with any problems to inform themselves, and Alpha One Canada has been a great resource for that. I hope I wasn't too confusing and long-winded with my answers, but I'd love to come back in a couple of months if you'll have me, because we keep learning things, and I know that I'll have new information in a couple or 2 months, some of which may be very applicable for Alpha One patients, and love to share that with you if I can.
Great. Thank you so much. We will be in
Take
touch.
care.
Thank you.